Hello and welcome to The Thought Bubble, a show created by the National Healthy Schools Collaborative Youth Council. I'm today's host, Luqman Mohammed, talking to you from Anaheim, California. I'm one of 17 members of the National Healthy Schools Collaborative Youth Council. For the past year, we have been working with school policymakers and other school health leaders to learn about mental health in schools, policies that will improve health systems in schools. To learn about our recommendations, please visit the National Healthy Schools Collaborative website at thrivingschools.kaiserpermanente.org. We are here today with a special guest, Hedy Chang, to learn about her ideas and experiences for improving student well-being through the lens of chronic absence. Hedy previously met with the Youth Council during a meeting with the adult leaders of the National Healthy Schools Collaborative, which consists of professionals from Kaiser Permanente and other national organizations that promote healthier schools. I also had the pleasure of meeting with her individually to help solve the issue of chronic absence within my own school. She is the founder and executive director of Attendance Works, a national organization that promotes student achievement through addressing chronic absence and has worked to make chronic absence a required reporting metric through the Every Student Succeeds Act. Hedy also received the White House Champion of Change honor in 2013 for her dedication to advancing African American education. Some of her work includes co-authoring the seminal report, which emphasizes the crucial role of addressing chronic absence in early grades, and she has authored many other papers on student attendance. Hello, Hedy. Welcome.
Thank you. It's great to be here with you.
Thank you for taking time out of your day to be here. We really appreciate it. Tell us a little bit about yourself and how you got into educational policies.
I have an undergraduate in poli-science, psych, and then went to the Kennedy School of Government. And then when I got out, I started to work for an organization called California Tomorrow, which really looked at how do you create a fair, equitable society. And education is an absolute essential institution because it's the place where people get their opportunities, where people also learn about each other and how you work together. How do we understand each other across our differences? And how do we also respect our differences and address inequities that have arisen over time and historically in our society? And so I think what I would say is that I've gotten here because I've always found for myself, for my family, and want to make sure for everyone else that education is that opportunity for a better life, for an opportunity to not only be economically stable ourselves, but to contribute to the larger society.
I couldn't agree more. I find education a great way for my family included to get a better path forward. Could you also go into more detail about what you've done with Attendance Works and how you started that organization and what it does today?
Sure. I actually started Attendance Works while I was a mom with kids in an elementary school, pretty economically diverse elementary school. And a colleague of mine, Ralph Smith, then the senior vice president of the NHSC Foundation, wanted me to look at whether or not kids missing too much school in the early grades was a reason why they were not reading at grade level and then not having a chance to graduate. And at the time, my oldest son, there was another young boy in his class who mom also cared a lot about him, but mom was on welfare, and I think he lived in the project, didn't have as much opportunity as my kid, but was a smart, caring kid. And in second grade, his mom, who I think never had real access to health, passed away really suddenly. My son and this child had the same birthday, so we used to celebrate their birthdays together in the classroom. And what I saw is even though we had a caring school, I cared, we knew this kid, we weren't quite able to help him as things got much harder for him going into the child welfare system. It was hard to keep and support him. And when I was asked to do this work to see whether or not kids missing too much school was something they were academically at risk, and if we could put in different kinds of systems and supports that could allow kids to succeed. I took this because I had a kid in my head, who was my inspiration, because I knew it wasn't fair, because I knew this kid had every potential as my own kid. And if we could find the right systems and supports, we could help make for a better outcome. And so that's how this originally got inspired. But that was, I guess, that was 2006, quite a long time ago when I started this work. And over time, what I came to realize is that attendance data which we take every single day in school, is something we actually don't use for action. We almost use it for accountability, not for taking action. So that we notice when a child is missing so much school that we actually need to intervene and support early. And we notice when there are lots of kids missing that much school, because it means there's a part of our system that's not working for those kids. And if we can then partner with kids and families to find out what that is, and then figure out what the solution is, whether that's healthcare, whether that's better transportation, whether that's because our school itself isn't engaging and supporting, or maybe they're even doing things in school that push kids out. But if we can use that data early to then work together to identify the challenges, we can come up with meaningful solutions. And that's what we've been doing for the last decade. And we've had a lot of progress. I will say it got a lot harder with the pandemic, but we're also starting to see things turning around.
Well, I commend all the work that you've done over the past few years. It's been amazing hearing what you've done for equity, for students that you described earlier that really need that push to get an education that they want. So kind of moving on, in terms of the attendance terminology, chronic absence and chronic absenteeism gets thrown around a lot, but not a lot of people understand what that is. Could you kind of go into what that means, especially from kind of the tools that you use?
One of the challenges is that, so chronic absence, we define it as missing 10% or more of school. That's, and if you use that as an early warning metric, it's 18 days over a whole school year, but it's 2 days in the first month, 4 days in the second month, 6 days. That's what I mean by being able to use it early. And it's different from truancy, which is only unexcused absences. When I'm looking at 10%, I don't care why the kid was missing school. Is it excused, unexcused? It's suspensions. And often those labels actually don't give us much information about what's really going on. In fact, they get in the way for us understanding what's going on. And so we want folks to look at chronic absence, not just truancy, and not just average daily attendance. Average daily attendance tells you about how many kids typically show up each day. Chronic absence tells you how many and which kids are missing so much school that something's amiss. And if we don't address it, they don't have the same equal opportunity to learn.
Interesting. So how would someone narrow down what kind of the causes are for certain students missing school?
We tend to talk about it in 4 big buckets. One bucket is barriers. One bucket is aversion. One bucket is disengagement. And one bucket is misconceptions. And let me say a little bit more about each one of those. So barriers are those things like lack of access to health care, like unaffordable transportation, unreliable transportation, lack of stable housing, that, or even neighborhood violence or trauma that create barriers to kids getting school. And those, by the way, many of them have gotten worse. Chronic illness has been a huge issue during a pandemic, but also the lack of health care is a huge issue now. We're even seeing unwinding of health insurance. So when we need healthcare to really be stable for kids, kids are losing it. The second thing is, that issue of aversion. And that's because things happen in schools that actually push kids out. Inequitable, poor disciplinary, where we're suspending, like there are places where they suspend kids for truancy. What a crazy, and then they suspend kids sometimes for things that are not really serious offenses, but just because a kid wasn't in a bad mood. If a kid feels and family feel that they're suspended unfairly, they're not going to come back the next day. So we push kids out. Or another issue can be bullying. Or right now we have a lot of anxiety. I know you guys have been looking at this issue of mental health, but when kids missed a lot of school and then they aren't caught up with where they are in their classrooms, and then they don't get much support coming back in, that anxiety can make them feel like school can't be a place where they can show up. So we literally push them out rather than support them being in. And then there's the issue of disengagement. And the issue is school at a place where kids want to be? Are you in school and finding it valuable? Are you in kids' school? And one of the keys to engagement is relationships, relationships with peers, relationships with adults. I'm sure you know this, at high school, the things that made me want to come is when I had both my friends, but also the teachers who cared about me, who knew me, who saw me, who, helped me feel like I had a better future. But there is a lot of challenges around relationships, both because we've been the challenges of a pandemic when we shut down school, and now the staffing challenges in schools, because you have to build a relationship. You have to have a stable teacher who's there the whole time. A long-term sub is just not going to do the trick. Or even short-term subs are going to be even more challenging. And then the last issue is misconceptions. And there's a number of things that I think it's always been a challenge that people don't see. Oh, I can just miss a day here or two, and it's not going to make a difference. Especially when subjects are what you call scaffolded, they build on each other. You would miss a couple days of geometry, and it's kind of hard to figure out where you are to keep going. There are a lot of classes like that. But sometimes we don't see that, or families with young children don't recognize what's happening in the classroom. I think it's also added to the fact that in the pandemic, folks said, oh, I can just learn online and I'll be okay. When online learning, often we don't have the quality of online learning we need. And now you don't even have access to online learning. So people sometimes think they can just take off and it doesn't have consequences. Right now, we're not at that point. And if you stay home for any sign of illness, you can't establish that routine of daily attendance, which is so important because routines are important for recovering from chaotic transitions, but also learning and connecting to peers. And if you're not in a routine of daily attendance, it's really hard to recover from this pandemic. But folks will stay home. I've got a stomach ache, which actually might be anxiety, but now I'm going to stay home for the stomach ache because I worry it might be a sign of illness, when actually we need to still show up to school. And so families have gotten trained to stay home for long periods of time for minor illnesses. And we got to go back to generally showing up to school unless you're really, truly sick. And I'm not saying that there are times where you should stay home, but we got to be much more careful about knowing when to stay home and when to keep showing up to school.
It's interesting you mentioned that. So with the COVID-19 pandemic and us going into the holiday season and the winter season, what kind of ways can we figure out how to miss school on days that we actually need to be, and make sure we go to school on days that we should be? And just from the family perspective, I know many of my peers and myself included, their family wants to make sure that their kids are going to school, and some kids don't want to go to school when they're feeling like any type of sick. So when should the family kind of push the student to go to school, even when they're just like has a little bit of a flu or a cough?
Yeah, so we actually, there's guidance on our website that I brought in a doctor because this is one of those times where you got to get some expertise beyond me. So brought in a pediatrician who we worked with the National Association of School Nurses and Kaiser Permanente to actually create health guidance. And the front of that guidance talks about, if you got a little cough, a little sniffle, you don't have a fever, show up to school. Got a stomach ache? Don't assume that means you can't, if you do have a high fever, stay home. If you think that you're got something really contagious, go call a doctor and figure out if you do or you don't. So I'm not saying come to school for any reason, but a lot of times, like let's say coughs or sneezes, people have allergies. Allergies are not a reason to stay home. And so if you know that you've got allergies and it's allergy season, you can make some pretty good judgments based on that. So again, minor illnesses are just not a reason to stay home from school. And we ought to be back in school whenever possible. Another issue can be fever. Actually the guidance on this has changed a lot. Now, what the American Academy Pediatrics says, if you had a fever and overnight it stopped and you're feeling okay in the morning, go to school. Some places you got to say you got to stay out for 24 hours, 48 hours. That's just not what the health guidance says from the doctors themselves. And so that means that we got to relearn some new health habits.
I know a lot of my peers have started to been wear masks when they go to school because their parents have been forcing them to, which is very good. Kind of touching on what you said previously about this whole behavioral health kind of piece and mental health kind of piece, how does our view of chronic absence and chronic absenteeism kind of reflect on student well-being?
Yeah, well, I think there's a couple things. I think when kids are chronically absent, we have to recognize this is a sign when we really need to collaborate with our health providers. And that collaboration can both be about prevention. There's a ton of things we could do to make sure kids don't actually ever get sick in the first place. Or, well, they might get sick, but at least limit it. Washing hands. And, chronic absence, one of the groups that it's highest among is among kindergartners. And I will say, kindergartners don't always know the healthiest ways to keep themselves from getting sick. Wash your hands, don't share your food. There's a bunch of things. Make sure that you get your vaccinations, you go have your well checkups. Dental care is a huge issue. Dental issues can cause kids not only to miss a lot of school, but when they're in school, if you've got dental pain, you're not exactly paying attention to class. And some of this is also the other thing that happens in a lot of communities, especially communities that are rural or high poverty. They don't have easy access to healthcare. When we collaborate with health providers to provide health and mental health support services, either virtual or in person, virtual can actually be a really helpful option. We can actually make sure that kids get healthcare immediately so they miss less school, or at least don't miss school because they're trying to go and find a doctor to figure out what's going on or to get support. So there's a whole bunch of things that we could be doing to prevent kids from getting sick, prevent kids from missing school due to illness. And then there's all those decisions about, okay, now you got ill, you were ill or become ill. How do we make sure that we can, that you only stay home if it's really essential for the health and well-being for yourself or for the kids around you.
Kind of touching on that last bit you mentioned. So what kind of resources, services can educators provide to help bring students to school, and what kind of ways can families also help engage their students and make them, or their children, and push them to go to school as well?
Well, I think what we have to have everyone recognize is that a routine of showing up to school in person just is so essential. And families, educators, everyone can talk, and kids themselves can talk to each other. By the way, there are a lot of families where the older kids are the ones who are helping the younger kids get to school. And so youth can very much be part of this solution too. So whether that's making sure everyone knows, showing up to school matters because that routine, which helps you calm down, which helps you not become anxious. That routine allows you to connect to peers and to adults. It allows you to access services and supports that might only be available in school. And it's so important for learning. So one is our messaging and making sure all of us think and understand why daily attendance matters so much. But the other things that we can be doing is we can help make sure we all have backup plans. We actually have something on our website, which is a student success plan. And part of it is a help bank. So think about, as you start school, and make a plan for this. Who are the people that get me to school every day? Who are the people who are my occasional helpers? Who are my emergency helpers? So that if something happens, or let's say you're an older student who gets your younger brother to school, and something happens where you can't, who are the people who can still get your younger brother to school? And so that you're also not late to school. We could be doing things where we really support each other. The other thing we can be doing together is to make sure that if we see challenges, we work together to report them and resolve them. Let me give an example. In Baltimore, they had huge challenges with the public buses. And literally there were not enough buses to take the kids to school, and kids would be left on, waiting for the bus, and then they wouldn't get to school on time because the bus was full and they just passed them on the street. So what they had worked out at the time was to have an app where they could all report it. So then at least the municipal bus services would know where the challenges are and they could resolve them. If you know that a lot of kids are being bullied, and that's creating issues, how do we have a conversation with our staff about where that is? I think staff can also do a better job of both talking with families and talking with young people when they see them not showing up. What's going on? Do focus groups, do surveys. There's one thing that I love. One school that we were talked to us on one of our, we have these things called e-learning. They're kind of a online professional development. And this school, when kids came in at the beginning of the year, they would survey kids and they would ask them about things like, do you have someone who you feel safe talking to on the school staff? And then they gave a bunch of lists, and it's a pull down menu. And what that does is a couple things. One, it makes sure that kids know we have safe people who you can talk to about the challenges and issues. And also that way, if something comes up and a school staff wants to know, what's going on, they know who the kid trusts so that they can talk with them. But if a kid can't fill out a name, that's a problem too. That means as a school, we haven't built relationships with young people so that we can help them. Because unless we can talk to young people and their families, we can't really know the challenges they're facing or come up with the solutions that are meaningful.
That's on that topic, just want to give a final question here. Just what kind of additional resources, whether that be for mental health, physical health, or just anything in general, in order to increase the student or family well-being, do you want to provide to the viewers in order for us to take away for just chronic absence and attendance in general?
I would refer to our website, just because I think what you need to do is map out, if you're working at a school level, what's happening at your school. What you want to do is both look at your school's data and understand which kids, which grades, who faces high levels of chronic absence, because that allows you to say, okay, those are the folks I need to talk with most deeply. Then on our website, you can even look at this thing called root causes. And then there's ways you can also link to all these things, whether there's surveys or these things we call like 2x10s, where staff talk to young people, or doing focus groups, different ways that you can engage folks. But the other thing I would just say is you also want to look at your school site and think about, and we have something called 3 tiers of attendance, and it actually builds upon something called the positive conditions for learning. And the positive conditions are learning are that we know kids come to school when they feel physically healthy and emotionally safe, when they feel a sense of belonging, connection, support, when they feel academically engaged, when they are surrounded by adults and students who have the well-being and the investments in their own health so that they can engage in relationship building. And the tiered systems of supports have to first make sure that those positive conditions for learning are in place, and then you use your data to figure out who needs more. So if you think chronic absence is a problem or a challenge at your school, not only do you want to look at your data, but you want to look at, do we have those systems of supports in place? And by the way, if high levels exist, it's probably because you don't have the basic positive conditions for learning in place. And then you really need to think about, how do you work with your principal, your school leaders, to put that in place? And so I think our website offers folks ways to start in on understanding what's going on in their situation so that they can come up with a plan of action for turning it around.
Thank you so much, Hedy, for this interview today. It's been an incredible experience being here and talking to you for everything that you've done for the educational community in the United States. Thank you so much.
Thank you. It's such a pleasure being here. And it always gives me hope and heart when I see young people taking on these issues and becoming advocates in their own right.